Greetings, Doc. My name is Reynard Martin Sales from the class DVM2, section A2. And today, I will be presenting to you on how to perform the physical examination, vital signs, and restraints. But before we start any further examination, we must first consider the following. First, we must write down anything we find during examination. Second, observe your patient from a distance to examine how they breathe, posture, sizes, or any abnormalities found in their body. Third, create a simple relationship with your patient to create a bond so future handling will be easier. And fourth, using of restraints. It should be done in an adequate manner to avoid hurting the patient. Now, the first step in our examination would be the physical examination. It entails the most basic function in all of the functionality in any of the exam, such as allowing to evaluate the medicine to be administered, the risks included in surgery and the health of the patient, and to evaluate on how the animal is to be admitted before procedures can be allowed. Such includes the following: signalement, history, general appearance, vital sign, physical exam, surgical risk, and lastly, RAVS, Anima Condition or RAC score. Signalement history allows us to further understand what type of patient is being administered to the clinic. Vital information that we can use to know our patient, such as their date, such as their age, date of birth, breed, species, or any medical histories that they have a database have. This source of information is a great reference to know on how we can administer our examination to our patient and evaluate. Next, we'll be observing the general appearance of our patient. It is best if we look to see our patients more clearly. We do this so that we will be able to see any changes. Are their body fat or malnourished? Responsive or bright? Their posture or hydrated? We can do this by looking at their bodies or checking via by handle or looking for a part. The best in evaluating this is using the head and tail system. We use this to compare the symmetry of the body in the patient's eyes, as I have the patient in the eyes, the nose, and the ears. This can help us assess the skin if there are any masses, wounds, dryness, or etc. So, with my patient here, they have perfect hair. There's no marks, no wounds, no nor is it too dry. This system also helps us identify any abnormalities with the heart and lungs, which we can identify by their sounds, by their normal sounds. For heart, the normal sound would be a lub dub. For the lungs, the normal sounds it would be generally a smooth, soft, and breezy. And lastly is the RAB score, which will determine the overall condition of the animal, such as the scoring is excellent, good, fair, poor, and critical. Now for the vital signs. This is where we identify them and measure the vital points of the animal. First is the heart rate. We can measure the heart rate of the patient by placing two of our fingers in the femoral artery, which is located in the hind leg, near the abdomen area. There, we can count for 15 seconds and multiply the beats by 4. Then we can get our total heartbeat. The normal heart rate of the dog is 60 to 120 beats per minute. For respiratory, we can measure it by observing the amount of breaths our patient took for 15 seconds, then multiply it by 4 to get our breath per minute. The normal breath per minute per dog is 10 to 30 breaths per minute. For the temperature, to take the temperature of our patient, we will take it through the rectally to get a better read. Note, we need to use lube or petroleum jelly to easily insert the thermometer without injuring the dog. The normal temperature of the dog is 99.5 to 10.5 Fahrenheit or 37.5 to 39.5 Celsius. Lastly is the CRT. To take the CRT, place your finger in the gums of the dog, press it gently, and see how fast the refill time is. The normal CRT is 2 seconds or below. More than that would be dangerous. Now, lastly, for restraints. Restraints are used to easily administer medicines or vaccinations while keeping the patients and the handlers safe. Though we must handle the patient with proper restraint as to not harm or aggravate the patient. Here are the different restraints used for dogs. First is the sitting restraint. We'll have our arm under the dog's neck while putting the other in the hind quarters to prevent the dog from standing or laying. Second, for standing restraint, we will do the same thing, with a hand on the dog's neck, while the other being on the dog's abdomen to prevent them from lying or sitting down. Next will be the sternum recumbency. In this, we are to put the dog in a sitting position while maintaining the hold on the head. Then, we are to grab the front paws of the dog and then lay them down. Make sure that the head is away from the doctor to prevent them from being beaten while drawing blood. Then, we are to push the elbow and expose the leg as for an easy access. Sternal recumbency is used to hold the dog while drawing out blood. Lastly, the lateral recumbency. The dog must be in a standing position. Then, we reach to the dog's foreleg and hind leg. Grab and slowly lift them to the table. After that, you grab both legs and spread them while using your forearm to immobilize the animal. Note, you must also keep your hand to the dog's neck to prevent them from biting you or the handle. That will be all. Thank you.